Can platelet-rich plasma be helpful in patients with rheumatoid arthritis? Hello, this is Dr. Siddharth Dambar, expert in rheumatology and regenerative medicine. Common question I get from patients who have conditions like rheumatoid arthritis or psoriatic arthritis is, can platelet-rich plasma or bone marrow stem cells be helpful in their condition? We do have some literature and evidence in the peer-reviewed literature now that helps to give us guidance as well. Study from 2021 done in Egypt took 60 patients with rheumatoid arthritis. All these people had mild to moderate disease activity, which means that their condition was still active and causing pain and inflammation. They were all taking some sort of disease-modifying treatment as well. They were then divided into 30 patients received steroid injections in their joints that were active, and 30% received platelet-rich plasma injections into their joints that were active. The patients who had steroid injections had improvement for the first 3 months, but then their condition came back to their baseline disease activity, meaning it was still back active after 6 months. The patients who received platelet-rich plasma, on the other hand, had a continued improvement for the full 6 months of this study. And this study just followed them for 6 months, so that's an impressive result that they continue to have improvement for the full length of this study. So the conclusions of this study are that yes, platelet-rich plasma can be used in rheumatoid arthritis patients who have persistent mild to moderate disease activity and are also taking medication. Some other notes from this study to be aware of. Really, the main thing is that the platelet-rich plasma dose that they utilized was very low. It was about 2.5 times the normal concentration of platelets. When we're treating a joint that is arthritic, normally you should be utilizing at least 10 to 14 times the normal concentration of platelets. So they utilized a low dosage and they still had good results. My suspicion is that if they use a higher dosage, they'd probably get an even better result. Some other personal perspectives here. I've been involved with regenerative medicine since 2008. I'm a practicing rheumatologist as well, so I see a lot of patients who have active rheumatoid arthritis or psoriatic arthritis who are asking how well can our regenerative treatments help with their condition as well. And for those patients that have severely active disease, I would recommend that they take the appropriate disease-modifying or biologic medication treatments that help control their overall inflammation. And then if there's still some residual disease activity, like a couple joints that are still active, then to utilize an orthobiologic treatment, such as their own blood platelets or their own bone marrow stem cells. So then it becomes, well, which one do you generally recommend, platelets or bone marrow? Both are really good options. In fact, I've had really good response in my patients in that kind of setting with either platelet-rich plasma or bone marrow stem cells. The one thing I would say for bone marrow stem cells is that because it has a higher concentration of things like IRAP and alpha-2 macroglobulin, which are intrinsic chemicals and molecules that you have in your own body that are strong anti-inflammatories, that bone marrow stem cell treatments can be really a home run treatment in this kind of situation. But either one is a good option. The other thing that's interesting to note is that in my own personal experience, for patients in this same kind of situation, if they're taking a disease-modifying treatment or a biologic treatment, they still really respond well to treatment, even though they're taking an immunosuppressant medication, meaning they still respond to the regenerative medicine treatments appropriately. And so this study correlates with that as well. The one exception would be if someone's taking high-dose oral steroids, in which case I would say try to reduce that dosage before actually utilizing your own platelets or bone marrow. Overall conclusion, this was a good study, very helpful. I think this should give confidence to physicians and those folks who are dealing with these kind of conditions, who are taking the right kind of medications, but now still have a couple joints that are active, that these kind of orthobiologic treatments are still really helpful in patients who've got rheumatoid arthritis. In addition, not to toot my horn too much, but this does sort of fit with what I've seen over the last couple decades of treating patients, of what we see every day in patients and what really works and helps people out. So very good to see that we have some consistency with other people that are treating patients as well. If you found this to be helpful, please subscribe to our channel. Check us out on our website, chicagoarthritis.com. If you'd like to learn more about how we can help, contact us. And until we connect again, have a good day and live well. Thank you. Bye-bye.